Today we'll discuss anti-arrhythmic medication. Previous talk we discussed about anti-arrhythmic events. Now, what are the anti-arrhythmic medications? Now, there is a classification of Vaughan-William classification for anti-arrhythmic medication. In this case, we defined as membrane stabilizing agent, that is sodium channel blockers. So, number 1, 2, 3, 4, grouping, 4 classes of antiarrhythmic drugs. Number 1, membrane stabilizing agent, sodium channel blocker. Sodium channel blocker may be 1A, 1B, and 1C. In 1A, the mechanism of action is that increase action potential, increase QT interval, and increase effective refractory period. So तीनों चीज इसमें इंक्रीज होता है 1A ड्रग ग्रुप में. Increase action potential, increase QT interval, and increase effective refractory period. Now, in this case, the examples are quinidine, very important, quinidine, procainamide, and disopyramide. Quinidine, procainamide, and disopyramide. So they are used in PSVT, atrial fibrillation and flutter, and ventricular tachycardia. So in all cases, we can use quinidine or procainamide or disopyramide. So in 1A, there is increased action potential. In 1B, there is decreased action potential. Decreased action potential is lidocaine, Mexiletine. Lidocaine, Mexiletine, it is also used in acute ventricular, that is post-MI ventricular tachycardia and digitalis induced arrhythmias. So lidocaine or Mexiletine, group 1B, decreased action potential. Now 1C is no effect on action potential. So in first 1A, increase action potential, in 1B, decrease action potential, and in 1C, no effect on action potential. So in this group, drug is Propafenone and Flecainide, Morisegine. So this Propafenone is very important because it may be asked in question, NEET question. So Propafenone, there is no effect on action potential. It is used in intractable supraventricular tachycardia, ventricular tachycardia that progress to ventricular fibrillation. So this is important because the 3 groups, three groups A, B, C. One is increased action potential, B may decrease action potential, and one see no action on effect on action potential. So third group ambassador is quinidine, procainamide group A, group B lidocaine, Mexiletine, and group C propafenone. Now class 2 is beta blocker. You all know Propranolol, Esmolol, and Metoprolol. It used in PSVT and atrial fibrillation. Beta blocker used in PSVT and atrial fibrillation. Now, third group is potassium channel blocker. Potassium channel blocker, it increase action potential and it also increase effective refractory period. So, it just coincide with the 1A, increase action potential and increase ERP, but here is no increase in QT intervals. So, potassium channel blocker. Now, examples are Amiodarone, Sotalol. Now, you see that Sotalol is used in potassium channel blocker in class 3 and all beta blockers used in class 2. So, Sotalol, Amiodarone, Beryllium, and Ibutilide. The uses also atrial fibrillation, atrial flutter, ventricular tachycardia, not Beryllium. जो इसमें एक एग्जाम्पल है ब्रेटिलियम, ये वेंटिकुलर टैकीकार्डिया में यूज नहीं होता है. So Ibutilide is called pharmacological defibrillator. Pharmacological defibrillator is Ibutilide. Ibutilide is called pharmacological defibrillator. So in class 3 is potassium channel blocker. Now class 4 is calcium channel blocker. Here is isoptine or verapamil, diltiazem. दो example है इसमें, verapamil and isoptine. Calcium channel blocker. It is also used in PSVT, MAC, atrial fibrillation, and atrial fibrosis. MAC means मल्टीफोकल एट्रियल टैकीकार्डिया, मल्टीफोकल एट्रियल टैकीकार्डिया में यूज होता है पीएसबीटी एंड एट्रियल फिब्रिलेशन फ्लटर। अदर में हम लोग करते हैं पोटेशियम चैनल एक्टिवेटर, it decrease in intracellular cyclic AMP. Best example is adenosine on digoxin sometime. So it is the drug of choice is an PSVT, paroxysmal supraventricular tachycardia, adenosine, acute cases.
अभी जो
But in
क्वेश्चन आया था,
prophylaxis,
नीट पीजी में, नीट पीजी में
yes,
जो क्वेश्चन आया था, लाइक
NEET
पीएसबीटी।
PG in 2024 आया था, what is the drug of choice in acute cases of PSVT? So it was IV adenosine. But this year, 2025, the twisting of this question, suppose patient is suffering from PSVT and repeated, so what prophylaxis you will do? So this is not adenosine, it is Verapamil or Diltiazem. Okay, so these are the important grouping 1, 2, 3, 4. So now you see the most antiarrhythmic are pregnancy category C. Most antiarrhythmic are pregnancy category C except Amiodarone, which is a pregnancy category D drug. Phenotine and atenolol should not commonly used in also a category D drug. So category C drug can be used, but category D drug cannot be used. Now, newer treatment of CCF में हम लोग include करते हैं दो drugs, एक सेकुबिट्रिल and इवाब्रिडिन. मेंशन द सीबीएस बाद में हम लोग देखते हैं, लेकिन इसको एंटीआरhythmic में इतनी इंपॉर्टेंट है. Side effect. Now, what are the side effects of these drugs, antiarrhythmic drugs? The most important side effect of amiodarone toxicity, very important, amiodarone toxicity, pulmonary fibrosis, corneal deposition, hepatotoxicity, skin deposition, photodermatitis, constipation, bradycardia, hypothyroidism is very important. It may cause hypo and hyperthyroidism both. Amiodarone, hypothyroidism and hyperthyroidism both. So this is the important amiodarone. Question may be asked that what is the side effect of, उसमें दे देगा hypothyroidism, hyperthyroidism, उसमें दे देगा photodermatitis, all of above. So this is important. Okay. Now quinidine. Quinidine is synchronism, synchronal-like activity, headache, tinnitus, thrombocytopenia, torsid D point is, that is increased QT interval. So quinidine causes increase in QT interval, that is torsid D point is. Procainamide, that is reversible SLA-like activity. Our adenosine causes cough and flushing. Sotalol is bronchospasm, beta blocker effect, Sotalol. So these are the side effect of antiarrhythmic drugs. So we have finished the drug-induced toxicity and drugs, different classes of antiarrhythmic drugs.
Yes. I want to add, there are many drugs which cause
Hello.
prolonged QT interval. There are many drugs which prolonged QT interval. There's also the drug of choice was magnesium sulfate. So there are a class of drugs. The table is given in the table is given in KDT.
Now, come to the point. You know that torsid D point is QT interval, very important QT interval. So QT interval measures the duration of electrical activation and recovery of the ventricular myocardium. QT intervention varies inversely with cardiac rate. Therefore, the normality of the QT interval can be determined only by correction of the cardiac strength. So, corrected QT interval is included in routine ECG analysis, calculated by Béziers formula. Now, what is Béziers formula? It is QTC, that is QT correction is equal to QT divided by square root of RR interval in second. So, it is the corrected. Now, important is that in upper limit of QT interval is nearly 0.46 or 460 millisecond in women. Women may 460 millisecond, but in male 450 millisecond. QT interval is slightly lower in female, longer in female, and longer duration sleep and increase slightly with age. Now, torsion D point is kya hai? What is torsion D point? Is the ECG hallmark of polymorphic ventricular tachycardia. It is also known as polymorphic ventricular tachycardia, torsion de pointis, or twisting of points. Is a QTC prolongation often in excess of 0.6 second, that is 600 millisecond. So, अगर QT 7 millisecond से ऊपर होगा, so it is QT prolongation or polymorphic ventricular tachycardia. Now, what are the causes of prolonged QT interval? सबसे important है hypokalemia, hypomagnesemia, hypocalcemia, renal failure and heart failure, and drugs, certain drugs. So drugs are very important. Now, what are the drugs causing prolonged QT interval or torsion depointation? Now, number one is anti-arrhythmic drugs. Anti-arrhythmic class 1A, that is disopyramide, quinidine, procainamide. Class 1A causes increased QT interval. हम classification में पहले ही बता चुके हैं कि class 1A causes increased action potential, increased QT interval, and increased effective repeated period. So QT interval class 1A. Anti-arrhythmic class 3 drugs like Amiodarone, Sotalol, Diltiazem also causes QT interval. Now, certain antimicrobial like erythromycin, clarithromycin and sulfur drugs. Antifungal में हम लोग देखते हैं फ्लुकोनाजोल, कीटोकोनाजोल, आइटोकोनाजोल. Antimalarial, chloroquine, halofentrin, mefloquine, quinine. Antihistaminic also causes terfenadine, estimazole, and diphenylhydramine. And GI procainamide is cisapride. These are all drugs causing increased QT interval. So, drug of choice of QT interval or toxicity point is IV magnesium. IV magnesium. ठीक है. और कुछ ड्रग है जो साइको एक्टिव ड्रग हेलोपेरिडोल, लिथियम ये भी कराता है. और एंटी HIV ड्रग में एफोवेरिंज कराता है, बहुत ज्यादा कराता है वो कभी कभी. और मिसलेनियस ड्रग में हम लोग एमेंटेडिन के टेक्रोडीमास करेंगे, बेसोप्रेसिन, इंडेफामाइड, सब कुछ करा सकता है इंक्रीज ईयर इंटरवल. सो क्लासिकल इज polymorphic ventricular tachycardia, torsion de pointis more than 600 millisecond is known as torsion de pointis, and it may lead to sudden ventricular fibrillation and death.
In
तो यार ये लोग जा रहा है,
TB drugs, na, in TB drugs,
क्या बोल दिया?
in TB drugs, basically, in TB drugs, basically, beta-quinyldelamide also have prolonged QT interval.
हाँ.